Hi everyone. In today's clip, I will talk a little bit about peptic ulcer. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, peptic ulcer disease or PUD refers to open sores that develop on the inner lining of the stomach, which is gastric ulcer, the upper part of the small intestine, which is duodenal ulcer, or occasionally the esophagus. These ulcers happen when the protective mucus layer is sort of compromised, allowing stomach acid and digestive enzymes to erode the tissue. Duodenal ulcers are more common than gastric ulcers. The main causes of this include Helicobacter pylori or H. pylori infection, responsible for about 42% of the cases. Also, long-term use of NSAIDs like ibuprofen, aspirin, naproxen, which is about 36% of the cases. Other risk factors are smoking, excess alcohol use, psychological stress, which may worsen the symptoms but not the primary cause, poor water quality, and crowded living conditions. So many people have no symptoms initially, but the common symptoms can include burning or gnawing upper abdominal pain, which feels often worse at night or when you're hungry, indigestion, bloating, belching, heartburn, nausea, and vomiting, and loss of appetite or early satiety, and sometimes weight loss. Warning signs of complication can include vomiting blood, which can be red or coffee ground sort of appearance, black or tarry stools, severe abdominal pain, dizziness, or fainting due to bleeding, of course. And if untreated, PUD can lead to gastrointestinal bleeding, slow or severe. It can go into perforation, which is hole in the stomach or duodenum, obstruction, which is blocking food passage, and anemia from chronic blood loss. Diagnosis is done through endoscopy, which visualizes ulcer and allows biopsy. H. pylori testing, like urea breath test, stool antigen test, or biopsy. Imaging, if perforation is suspected. And the treatments normally include eradication of H. pylori with a combination of antibiotics and proton pump inhibitor or PPI, acid reduction, H2 blockers, and stopping NSAID use and use alternatives, lifestyle changes, avoiding smoking and alcohol. And surgery is rare for complications like perforation or obstruction, of course. On the orthomolecular medicine side, peptic ulcer management and recovery is done through individualized recipes containing vitamins like vitamin C, 2,000 to 4,000 milligrams a day in divided doses, vitamin A, 10,000 to 25,000 international units a day, zinc, 30 to 50 milligrams a day as zinc gluconate or citrate, selenium, 100 to 200 micrograms a day as selenomethionine, probiotics, 10 to 20 billion CFUs a day, multi-strain, 11 or more, L-glutamine, 5 to 10 grams a day, bioactive compounds such as licorice, DGL, 380 milligrams a day, which are in chewable tablets 2 to 3 times a day before meals, mastic gum, 500 milligrams a day, which is shown to inhibit H. pylori, curcumin, 500 to 1,000 milligrams a day, and we also emphasize high protein, antioxidant-rich, fiber, and fermented foods. So the discovery of Helicobacter pylori drastically changed our understanding of ulcer disease and led us in the area of antibiotic-based therapy. However, this success story has steadily eroded. Around the world, and especially in Africa, H. pylori antibiotic resistance has climbed to alarming levels, reducing the effectiveness of current triple and quadruple regimens and leaving doctors with diminishing options, basically. In this context, a group of researchers at the University of Ghana Medical School have reported a small but remarkable clinical series 14 patients with chronic symptomatic peptic ulcer disease were sort of fully relieved of symptoms after a 4-week monotherapy course of extremely diluted 0.5% food-grade hydrogen peroxide, or FGHP. So taken orally 3 times a day. 10 of the 14 had confirmed H. pylori infection prior to the therapy. None of the participants reported significant adverse side effects, and none have relapsed, with some now being ulcer-free for over 3 years. Now, hydrogen peroxide, or H2O2, isn't just something you use to clean cuts at home or disinfect. Your body actually makes it as a part of its natural defense system. Certain immune cells, like white blood cells, produce hydrogen peroxide to help kill germs. Hydrogen peroxide reacts with metals like iron, which is found in some bacteria, and creates powerful particles called hydroxyl radicals. These radicals damage and destroy the germs by breaking down their structure. It's like a chemical weapon your body uses to fight infections. So the Ghana team had already seen amazing results using tiny amounts of food-grade hydrogen peroxide, or FGHP, from 0.5 to 1% taken by mouth to treat stubborn nail fungus, even when regular antifungal medicines had failed for years. The report suggested that this gentle oral hydrogen peroxide might help it spread through tissues better and boost the body's own natural germ-killing process. The research team presented detailed case reports of 14 adult patients ranging the age from 37 to 94 with peptic ulcer disease lasting from 2 to over 30 years. Some of them, several had sort of undergone multiple rounds of conventional therapy, including proton pump inhibitor, H2 blockers, antacids, and various antibiotic combinations without any lasting improvements. Each patient had received 40 milliliters of 0.5% food-grade hydrogen peroxide 3 times a day on an empty stomach for 4 consecutive weeks. Patients were told they might feel burning or pain in the stomach after the first few doses, which happens because the solution touches the sore area, basically. And drinking water right away makes the discomfort go away. The amazing part, all 14 patients felt completely better within 2 to 4 weeks. So on the week 1, they had a bit of pain after dosing. Week 2, the symptoms were diminishing. And week 4, it was complete resolution. The concentration used in this study, as I mentioned, was 0.5% food-grade hydrogen peroxide, is far below the levels used for disinfection, which is 3% VC. Also, the one that you see in the drugstores is not food-grade, so that needs to be clarified. Because food-grade hydrogen peroxide they used had to meet strict purity standards and contain no stabilizers or toxic contaminants. Metaphysically speaking, ulcers are sometimes linked to inner conflict and stress, especially feelings of being attacked or under pressure. It can symbolize difficulty digesting life experiences, meaning you may feel overwhelmed or unable to process challenges. A common theme usually is fear and anxiety about the future or feeling unsafe. Chronic worry or perfectionism, repressed anger, holding in frustration sort of instead of expressing it, feeling unsupported or unloved, a sense of disconnection from inner peace or higher purpose, living in constant fight or flight mode rather than trust and surrender, can also be contributors to this ailment. Ulcers can be seen as a call to slow down, nurture yourself, and restore balance. Hope this has been helpful. Like and follow for more. Be the light.